I am thinking that Vasa concept is the invention of the century. And when you are learning something new, first comes the thinking. So today we are focusing on thinking part. Second comes that you can explore things with your own body, and then you can do hands-on practice with your patients. And after that, you are ready to learn the theory. Learning a Vasa concept is a long journey. Year by year, you are coming better and better. I hope that someday you will get to know that Vasa concept is so much more than these points. These are only for that we can start the thinking. The process is starting. You are most welcome to learn Vasa concept levels or some different names to learn theory and also Vasa concept webinars and courses. And then comes the first, think out of the box. Think of today and compare it to history. If we are watching this picture, we are seeing that 100 years has gone by, but the results are the same. Something needs to change and quickly, because we need these patients back to work, back to normal life, and pay taxes, and enjoy their lives and fulfill their dreams. And these men are not the only one. This happens all the time, that we are not able to get patients back to normal body and back to live the normal life. But this is good picture for showing that even these are well-known men and they have had lots of rehabilitation. Still, the problem is the same. USA Senator Mark Kirk has possibly the most amount of high-tech tools for rehabilitation in the whole world. The Mark Kirk has walked more than 10 miles, and still I'm thinking, is this the best result that we can have? Is the all that we can do? And is the patient happy with this? Do they want something more? And then, what word think as a rehabilitation exercise? And here you can see how the Mark Kirk has done the exercises. I hope that you are hearing this video, what they are saying. But they are now explaining that Mark Kirk has had the stroke. And it was all over the news in USA. And then the Mark Kirk is explaining about the rehabilitation. And I hope that you think that how much the Kirk is using his better side of the body while walking, even on robotic training. I hope that you are hearing my voice, even the video audio is not now working for some reason. And I would like to ask also that why walking is a symbol of recovery, where the reason is coming from. And is this a normal gait? Is this what we want? And just check the spasticity in there. And look at the cane and abnormal gait. And then we are going to next one. What we see as a result. Now it's Mark Kirk's first workday. He is getting back to his work. And is this really the best result what we can have? There's so much spasticity. There's the cane. The upper limb is so up there. So I am asking again, why we are using walking as a symbol of recovery? Because the walking, that walking is not normal. It is not a normal gait. And here is the doctor saying that Mark Kirk is not likely to regain a full range of motion of his left side. So doctors around the world needs to know that it is possible to recover. Because this is from the USA, and I think that they have the most amount of high tech and robotic and everything. And there's something is not working now if the results are like it. Yeah. Are we getting better results with Vasa concept? Now I am showing you what really is possible. Mark Kirk has repeated walking and you now have seen the results. If you repeat Vasa concept, results are totally different and you can see those on the next video. So you really need to think what you are repeating. And on this video, there's text everything what you need to hear. So no voice in this video. So I hope that you start to analyze the walking. You are checking the pelvis and buttock and knee and ankle and everything. How is it working? What are the splints doing and what the leg inside the splint is doing? Which side of the body is doing the more work? And here is the hand in the beginning. There's lots of spasticity and stiffness. And soon you can see that from this hand you can get the spasticity into active movements. And I would like to ask from you also that did you know that this is possible? Because this is totally different than Mark Kirk's results. Fingers are opening and closing now. And exercises are so easy to do at home. You don't need to go to the gym to do these exercises. You can do this at home. And check the whole body. The arm is not the only thing that has changed. Check now the pelvis and when you are walking in a squat position, how that is making walking better. And from here you can see that there is no spasticity anymore. And from one exercises you can practice the whole body. And check the quality of the movement. Remember the walking in the beginning. And now you can see how the girl is jumping. And you need to also remember that breaking movements are important. It is also important to come down from stairs. And here's another example for how with one exercise you can practice the whole body. So goal in Vasa concept is also walking. And now compare this walking. Can you notice all the difference from the walking earlier? How is the buttock and pelvis? How is the knee? And the ankle and the foot? And our patients want recovery like this. They don't want recovery like Mark Kirk has. They want recovery like this one.